The truth about life is this: you can have 100 problems, money, work, relationships, plans, but the moment you develop a health problem, you suddenly only have one. Everything else fades into the background. For John, a 52-year-old father of two, that lesson came far too late. John was the kind of man who worked hard, didn't like to bother anyone, and rarely went to the doctor. A small streak of blood in his stool one morning was easy for him to brush aside. He told himself it was just hemorrhoids, nothing to be embarrassed about. A change in his bowel habits over the following weeks? He blamed it on stress and a rushed diet. The fatigue that started to creep in? He thought it was simply middle age catching up with him. But slowly, without him even realizing it, John's world began to shrink. He was skipping meals because of abdominal discomfort. He found himself sitting out of family walks because he just didn't have the energy. Yet he told no one. He convinced himself that it wasn't urgent. He thought he could manage. By the time John finally saw his doctor, the story had already changed. What might have been a small, removable polyp had grown into something much bigger. The colonoscopy revealed advanced cancer. What had once been a problem that could have been cured with a short procedure had now become a battle for his life. His 100 problems suddenly became one. This is the devastating reality of colon cancer. It often begins quietly with subtle changes that are easy to ignore. And because it rarely causes pain in the earliest stages, people, like John, put off seeking help until it is far more difficult to treat. But here's the important part: it doesn't have to be this way. If you're new here, welcome to the channel. I'm a UK medical doctor, and I make videos to help you understand the health issues that really matter. So, well done for taking this first step in putting your health first. In this video, we will talk in detail about colon cancer symptoms you must be aware of, the treatments available, the myths that so many people still believe, and most importantly, what you can do right now to protect yourself. When people ask me, what are the symptoms of colon cancer? The truth is that they can be incredibly varied, but there are some key patterns we must all know. One of the most common symptoms is blood in the stool. This can look different depending on where the tumor is located. If the cancer is in the left side of the colon or in the rectum, the blood is often bright red, streaked on the outside of the stool, or noticed on toilet paper. If the cancer is higher up in the colon, the blood may be darker, even black, because it has traveled further and been partially digested. Some patients don't see any blood at all, but when we test their stool with sensitive screening tests, tiny amounts of hidden blood, called occult blood, are detected. The problem is that many people assume bleeding must be from hemorrhoids, which are indeed common, but the danger lies in assuming. A doctor can tell the difference with proper tests, but no one can safely dismiss it on guesswork alone. Another key symptom is a change in bowel habit. This might be diarrhea that doesn't settle, constipation that's unusual for you, or a feeling that you need to go but don't completely empty. Why does this happen? Because as a tumor grows inside the bowel, it begins to narrow the passage. Stool moves around it differently, sometimes looser, sometimes harder, sometimes leaving that sensation of incomplete evacuation. What's crucial is persistence. If you've had a change lasting more than 3 weeks, it is not just diet until proven otherwise. Then there's abdominal pain. Many patients don't develop pain until later, but when they do, it can be cramp-like, colicky, or a persistent ache. Some describe bloating or a sensation of fullness. In advanced cases, the bowel can even become blocked completely, leading to severe pain, vomiting, and a medical emergency. Weight loss is another red flag. People sometimes notice their trousers feel looser, or the numbers on the scale drop without any effort. Cancer cells demand energy, and the body begins to break down fat and muscle. It's not just about appetite loss, it's about the disease itself changing the body's metabolism. Then there's fatigue, often linked to iron deficiency anemia. Tumors in the colon can bleed slowly, a little every day, not enough to see, but enough to gradually drain the body's iron stores. Patients present with tiredness, shortness of breath, even palpitations. Many are shocked when they are told their anemia was due to an underlying bowel cancer. There are also subtler symptoms: nausea, a lump felt in the abdomen, or even unexplained changes in how clothes fit due to bloating. These are less specific, but in the right context, they matter. So, what happens when someone like John finally presents to the doctor? The process usually starts with a history and examination. If there are red flags, the next step is often a stool test, such as the FIT test, looking for hidden blood. If abnormal, or if suspicion is high, the gold standard is colonoscopy. Colonoscopy allows direct visualization of the bowel. Small polyps can be removed on the spot, preventing them from ever becoming cancer. Suspicious growths can be biopsied for a definitive diagnosis. In some cases where colonoscopy isn't possible, a CT colonography, sometimes called a virtual colonoscopy, can be done. If cancer is confirmed, staging tests follow. This often involves CT scans of the chest, abdomen, and pelvis, sometimes MRI for rectal cancers, to determine how advanced the disease is. Staging is critical because it guides treatment. Stage 1 disease, limited to the inner lining of the bowel, can usually be cured with surgery alone. Stage 2, when the cancer has invaded deeper layers but not lymph nodes, may still be curable with surgery, though sometimes chemotherapy is considered. Stage 3, with lymph node involvement, usually needs surgery followed by chemotherapy to reduce the risk of recurrence. Stage 4, when the cancer has spread to other organs such as the liver or lungs, is usually not curable, though surgery may help in select cases, and chemotherapy, targeted therapies, or immunotherapy can extend life and improve quality. Treatment has advanced dramatically. Surgical techniques are safer, often minimally invasive. Chemotherapy regimens are more tailored, with drugs that target specific pathways. For some rectal cancers, radiotherapy is used, and for advanced cases, clinical trials are offering new hope. But no matter how good our treatments get, nothing beats early detection. Now, let's talk prevention, because this is where we as individuals have real power. Colon cancer is strongly linked to lifestyle factors. A diet low in fiber and high in processed meats increases risk. Fiber helps bulk up the stool and keep it moving through the bowel, reducing exposure of the lining to carcinogens. Processed meats, especially those high in nitrates, have been shown to increase cancer risk. Reducing these while eating more fruits, vegetables, and whole grains lowers risk. Physical activity matters too. Regular exercise reduces inflammation, improves immune function, and helps maintain a healthy weight, all protective against cancer. Obesity, particularly abdominal obesity, increases risk. Smoking and heavy alcohol consumption also raise the likelihood of developing colon cancer. And then there's screening. If you are invited for bowel cancer screening, take it. It saves lives. In countries where screening programs are robust, deaths from colon cancer have fallen significantly. Now, let's do some myth busting, because misinformation is one of the biggest barriers I see in practice. People often ask, isn't colon cancer only an old person's disease? No. While age is a risk factor, cases are rising sharply in younger adults, even those in their 30s and 40s. Lifestyle changes, obesity, and perhaps genetics play a role. If you're younger and have symptoms, don't let anyone dismiss them. What if no one in my family has had it? Doesn't that mean I'm safe? Again, no. The majority of people diagnosed have no family history. Yes, having relatives affected raises your risk, but absence of family history does not mean immunity. Is colonoscopy dangerous? It's one of the safest procedures we perform. Complications like bleeding or perforation are very rare. And the benefit, detecting a cancer early or removing a polyp before it turns cancerous, vastly outweighs the small risks. Isn't blood in the stool always just hemorrhoids? No. Hemorrhoids are common, But assuming blood is from piles without investigation is dangerous. If you see blood, you need a proper check. I feel fine, so I can't have cancer, right? Unfortunately, wrong. Early colon cancer often causes no pain and very few symptoms. That's why screening is so important. Another one I hear, if I get colon cancer, it's a death sentence. That's outdated. Survival rates have improved enormously. For cancers caught early, cure rates are excellent. Even in advanced disease, modern therapies can extend life meaningfully. And perhaps the most dangerous myth, I'll wait and see if it gets worse before going to the doctor. That's exactly how people like John lost their window of cure. Time matters. Early action saves lives. As a doctor, I've seen both ends of the spectrum. I've seen patients who came in early, had a small polyp removed, and went home cured. They barely missed a day of work. And I've seen others who delayed, came in too late, and faced grueling treatments with limited hope. The difference between those two stories is not luck. It's timing. John once told me, I thought I had so many problems in life, my job, my bills, my stress, but now I realize I only really had one problem, and it's the only one that matters. His words are etched into my mind, because that's the truth about health. When it's gone, nothing else matters. So let this be your reminder. Don't ignore blood in your stool. Don't ignore changes in your bowel habits. Don't ignore unexplained weight loss, persistent pain, or fatigue. Take part in screening. Live a lifestyle that lowers your risk. And if something feels wrong, act. Because while colon cancer can be devastating, it is also one of the most preventable and treatable cancers we know. The power lies in recognizing it early and not letting fear, embarrassment, or myths stand in the way. If this video has given you something to think about, please share it with someone you care about. It might be the nudge that gets them to the doctor in time. And if you'd like to see more life-saving stories and health explained simply, subscribe to the channel. Together, we can raise awareness and help people act when it matters most.